Welcome back to Dosing Through the Downfall. I'm your host, Kelly Hanner. In today's episode, we're digging into what I call the piggy bank problem, how the FDA pulled the plug on compounding, how Big Pharma turned GLP-1s into a cash cow, and why the same dysfunction has been happening for decades with hormones. And of course, I'll also share how my practice is different because you deserve more than a system that keeps you sick. Let's dive in. If you want to know how to rig a market, you create a shortage, let compounding pharmacies step in to help patients, and then the moment Big Pharma has shelves stocked again, the FDA declares the shortage over and slams the doors shut. Patients lose, pharma wins. That's the piggy bank problem. And today I'm pulling back the curtain on how the FDA sold us out, how Big Pharma is making billions off GLP-1 medications, why the same corruption shows up in hormone therapy, and why I refuse to play their little games. Let's start with GLP-1 medications. These drugs aren't new. They've been around for almost 20 years. In 2005, Byetta was approved for diabetes. In 2014, Saxenda, another GLP-1, was approved for weight loss. 2017, Ozempic came out for diabetes. 2021, Wegovy was approved for weight loss and even expanded to adolescents in 2022. 2023, tirzepatide, Mounjaro for diabetes, Zepbound for weight loss. So why does it feel like GLP-1s just appeared out of nowhere? Because for years they were marketed quietly for diabetes. But when the weight loss results became undeniable and the FDA expanded approvals, Big Pharma saw an opportunity and they ran with it. Here's the problem. Insurance companies pulled back. Medicare doesn't cover obesity drugs. Medicaid is hit or miss depending on the state you're in. And many private insurers said no unless you were a diabetic or you had serious complications. So what did that do? It forced patients into two choices: pay cash, upwards of $2,000 a month in some cases, or look to compounding pharmacies for more affordable access. And when the powers that be realized compounding was helping tens of thousands of people, the FDA swooped in to save the day for Big Pharma. 2024, December of 2024, tirzepatide shortage was declared resolved. Compounding shut down by March of 2025. February 2025, semaglutide shortage declared resolved. Compounding shut down by May of 2025. Who signed those decisions? Dr. Patrizia Cavazzoni, that's a very difficult name to say, signed tirzepatide before leaving the FDA in January, and weeks later she was Pfizer's chief medical officer. That's an interesting transition, isn't it? Kickback, perhaps? Guess we'll never know. Dr. Jacqueline Corrigan Curry signed semaglutide. It is too bad that Open Secrets doesn't allow for us to see whether or not these two women, if I'm even allowed to call them women, had an increase in their financial assets. So what was the result of their decisions? Patients lost choice. Might I add that happens far too often. And Big Pharma? They cashed in. Big time. In the first 6 months of 2025 alone, Eli Lilly made $14.7 billion, yes, billion with a B, from tirzepatide. Novo Nordisk made $17.7 billion from semaglutide. In case you missed that, I said billion again with another B. Together, that's over $32 billion in a half a year, much of it direct cash from patients' pockets. This wasn't about safety. That, my friends, was a blatant lie. This was about money. A lot of money. The piggy bank problem in full view. And GLP-1s aren't the only place this dysfunction shows up. We've seen it for decades with hormones. Let's talk about lab ranges. The normal ranges for men and women are massive. They were built from averages of entire populations, including people who are overweight, inflamed, sedentary, and sick. That means the reference range doesn't define health, it defines average. So when your hormones are scraping the bottom of that range, you're told you're normal. But you're not fine. You're exhausted, foggy, depressed, and weak, yet dismissed because your numbers fall inside a box. And here's the ugly truth. The system decided long ago that normal was good enough, not because it serves you, but because it serves them. If they keep you unhealthy long enough, you become a lifelong Big Pharma customer. Think about it. When hormones aren't optimized, here's what happens. You're fatigued and foggy, they'll hand you an antidepressant. Your blood pressure's creeping up, they'll hand you a blood pressure pill. Cholesterol rising, here's a statin. Low libido or erectile dysfunction, here's another pill. Can't sleep? Sleeping pills. Pain from weight gain and joint stress? Pain meds, maybe even physical therapy. Don't even get me started on the expense of physical therapy. Instead of giving you the one therapy that could restore balance, hormone replacement to an optimal level, they patch you with prescriptions that keep you dependent. And if they deny you GLP-1s when you're obese, the same cycle. You stay obese, and you progress to type 2 diabetes, you develop cardiovascular disease, your cholesterol spikes, your joints break down, you end up with chronic knee pain, hip pain, back pain. You're on cholesterol meds, blood pressure meds, pain meds, maybe you're headed for surgeries. By denying you care that could restore health, the system manufactures chronic patients, and chronic patients are profitable. That's the real story behind the wide normal ranges and the barriers to therapies that actually work. It's not an accident. It's a business model. This is where I draw the line. At Dynamic Rejuvenation, I don't treat people like revenue streams. I don't dismiss symptoms just because a lab says normal, and I don't believe in patching problems with prescription after prescription. Here's how I practice differently. I listen to your symptoms. You know your body better than any lab slip. I test before I guess, but I use labs as a tool, not the final word. I aim for optimal, not just normal, thriving, not barely surviving. I provide ongoing support, tracking, adjusting, and walking beside you, not handing you a script and disappearing. I integrate coaching, nutrition, lifestyle, and medications as part of a bigger picture. Tools, not magic bullets. GLP-1s can be powerful tools. Hormones can be life-changing, but only when they're part of a holistic plan that looks at the whole person. That's the dynamic rejuvenation difference. Because at the end of the day, you are not Big Pharma's piggy bank. You deserve better. You deserve to thrive. If this episode fired you up, hit subscribe, share it with someone who needs to hear it, and leave a review. Want to know what labs might matter for your journey? Check out my website at dynamicrejuvenation.biz or schedule a consult with me for a deep dive. Next time, we'll keep following the money and digging deeper into the downfall and how you can protect yourself from becoming just another statistic. And let me end with this. What I share here is my perspective. It's meant to educate, challenge, and open your eyes. It's not a replacement for personalized medical advice. Your body is yours, and your care should always be directed by a trusted licensed provider who knows your history. I don't sit here because I'm a pawn in their system. I sit here because I've seen how the system chews people up and spits them out. I don't bow to Big Pharma, and I don't play their games. I show up here because you deserve to know the truth.